What are your golden years going to look like? We kind of see two different paths. One path is the one most people envision: long quality of life, travel, family time, staying mentally sharp into your 80s and 90s. The other path is the one we often see, unfortunately, which is chronic illness, medications, pharmacy visits, doctor visits, hospitalizations, and procedures. The question is, which path are you going to take? When we see people in the clinic every day, they always talk about quality of life as the most important thing to them. Well, exercise and physical activity is the number one way you can improve your quality of life and live the best life that you want to. Movement as medicine for your brain and for your heart, today on Living Heart Smart.
Hi, everybody. Welcome back to Living Heart Smart. I'm Dr. Carolyn Lacey, and this is my co-host, Dr. Matt DeVane. And today we're talking about reducing our risk of death, because we know that really, when you get down to it, most of us are going to die from one of three things: cardiovascular disease, neurodegenerative disorders like Alzheimer's disease and dementia,
Right.
or a cancer. And exercise, actually, believe it or not, is one of those treatments that can help prevent all of those things, and it can help treat all of those things. So what better time to start talking about exercise? It's summer. Weather's great. Let's go outside, right, Matt?
Great. Good point. Yeah. I've become reinvigorated with my passion for exercise for a couple of different reasons. This is one of the reasons we wanted to do this episode today. One reason is just the good data that keeps coming about how exercise improves your quality of life, affects your cardiovascular health, and improves your chances of good longevity. But I think secondarily for me has been a lot of the new data on resistance training, strength training, what that can do for your quality of life, for your core, for your mobility, for your brain, and those things, and how we're putting that together now is really important. Our goal today is really to reevaluate where we stand with the data and try to get people to recognize that exercise is the single most important thing they can do to have those good quality of life years, those extended years where your brain and your heart are working together for a long time.
And when it does come to exercise, there is a tremendous amount of data and science behind it. So why don't we talk about some of that data a little bit? Let's bring it to life. We know that it works, not just from our own observation, but from trial after trial. So let's go into some of the science.
I think if we're going to start, there's good data both from the heart standpoint and the benefits exercise has, and then from the brain and Alzheimer's and dementia and memory standpoint, which we can talk about a little bit later. But we can start with the heart. I mean, three big trials that come to mind for me would be the Framingham study, which has been around for 70 plus years, where they follow people over time. And what they found there is that you have markedly improved longevity and decrease in cardiovascular events directly associated with the exercise that you do. Carolyn, there was another study called the Enter-Heart study. And the reason I like this one is because they looked at people all over the world. They also found that moderate intensity exercise reduces your risk of heart attack by a big margin. So less heart attacks doesn't take much effort to prevent if you're moving your body. And the third one I just want to mention is the Harvard Alumni Health Study. This looked at 17,000 men, and what they found was that moderate intensity exercise, just walking 30 minutes most days, decreases your risk of overall deaths, not just cardiovascular, but your overall risk of dying by almost 40%. These numbers are incredible to think about, because there's certainly no medicine on this planet that could do such a thing.
Right.
Yeah, right.
So why don't we talk about the cardiovascular magic that's happening? So we have the data that supports that everything is so much better, but what's actually happening in our bodies? So we're cardiologists. We're going to start with the cardiovascular stuff first. Yeah. And I think of exercise like a tune-up for your entire cardiovascular system. First thing that's happening, you like that? Yeah. So the first thing that's happening is your heart's becoming more efficient. And we know that because there's a parameter that we look at called the stroke volume, how much blood your heart squeezes out with every single beat. And as you do your aerobic activity, this helps increase your stroke volume with every beat. And this actually shows up in people with the resting heart rate. So you have someone who's a regular exerciser or who may be a very elite athlete, their heart rates are slow. They're 40, but they feel great because with each beat, they pump out more blood to maintain their cardiac output.
Right. And it's amazing, Carolyn, just with a patient comes in our office, You can tell so much about them with a few numbers. What's their blood pressure? What's their resting heart rate? And what's their weight? If you have those three things, you can just tell. It's magic. You can tell what the future is going to bring. And when I see someone come in with a normal blood pressure and a baseline, a resting heart rate of 50 or 55, I think, okay, this is a good start here. We're in good shape.
So when you compare that to, though, the people who are sedentary, heart rates are higher, 70 to 80 beats a minute. And it really just shows that your heart has to work harder to do the same job when you're sedentary.
Yeah, there's no doubt. Exercising more makes your heart more efficient, but it also does other great things for your heart, right?
It also can trigger really the growth of new blood vessels, what we call angiogenesis. And it's like creating more of these highways, if you will, for blood flow. And it really works within the tiny small vessels, the capillaries. It increases the capillary density, and it acts like a natural blood pressure medication as well.
Yeah,
so
it does.
We saw that with the DASH trial. When you're doing regular aerobic activity, it improves the compliance of our arteries, and that really shows by lowering our systolic blood pressure like 5 to 7 millimeters of mercury, which is great.
No, when people think, oh, it's only lowering by 5 or 7 points, but that's what medications do. That's just kind of the expectations of one layer of medication is to lower by 5, 7 points. So exercise does that alone. Yeah, Carolyn, I really think that the exercise benefits on the cardiovascular system are pretty fascinating. Exercise increases nitric oxide in your system, and nitric oxide helps relax your blood vessels, helps them dilate. Overall in your body, you get improved insulin resistance, you get decreased inflammation, the blood pressure we talked about. There's so many good benefits there.
Right. And if you haven't been excited enough by what happens with the cardiovascular system, I am, but not everybody is. And that's okay. But here's something that motivates a lot of people. Exercise doesn't just work for your heart. It's medicine for your brain.
Yeah, that's really got me pumped up lately. The more the new data comes in about how it's going to help your memory and decrease Alzheimer's risk and dementia risk is stunning.
Right,
yeah,
stunning.
It's incredible.
So recent research has shown that if you're a regular exerciser, you have a 20% reduction in your risk of the development of Alzheimer's disease or dementia compared to somebody who doesn't. And we don't have anything that does that.
No.
Nothing has ever shown that before.
There's nothing available now, and I don't see anything coming in the near future that will have those kind of benefits for your brain.
Totally
it's incredible.
Agree.
Yeah.
It's really incredible.
Yeah, there's a Hopkins study that showed a decreased dementia risk by 35 to 40% with just exercising 35 minutes a week. Not a day, but 35 minutes a week decreases your dementia risk big time. Another study showed moderate intensity exercise regularly also improved the brain's memory centers. When I talk to my friends about exercise, they always ask me questions. You know, we're kind of getting to that age where people are thinking about it, but they're also thinking more about their parents are having dementia problems. They're starting to forget things, and like, where does exercise play a role here? And so it's a critical part of the aging process. If you want to extend your brain's life, you need to exercise.
And when you get down to it, Matt, the mechanism of how exercise works in the brain, it's really the same as it is in the cardiovascular health, right? Exercise improves blood flow to your brain. It helps improve all those neural networks that are forming new connections, and it reduces inflammation, which is all better for your brain health.
Right. I like how you said neural networks. I like that. Okay, yes.
It's good. That's how I think about them.
Right. Yeah, it's incredible. So I'm glad we're including this cognitive stuff, this information about exercise and brain health, because they all go hand in hand now. And even though we're cardiologists, our patients complain just as much about their memory and Alzheimer's and dementia as they do about heart issues. So get moving. Okay, and how are we going to get moving, right? There's two major types of exercise, both the aerobic exercise and strength or resistance training. Both of those things should be part of everyone's regimen going forward.
Aerobic exercise, cardio exercise, walking, jogging, cycling, swimming. This type of exercise is primarily challenging our cardiovascular system to deliver oxygen to our muscles that are working. And this type of exercise improves what we call our VO2 max. And that is our body's ability to use oxygen efficiently. These benefits are pretty easy to understand. The higher your VO2 max, the more oxygen your body can consume and use that oxygen more efficiently to generate our cells building blocks, what we call ATP, the maximum amount of energy to improve the power for our cells.
Yeah, the better shape you're in, the more efficient this energy use is going to be. And one way we can measure that is with this VO2. VO2, at least for me in my clinical practice, isn't something that I talk about too much. I'm
Right.
not asking patients about their VO2, but we're hearing more about it. These readings are now coming on smart devices, smartwatches, and so we're asked about it more and more. Now, I don't think the data around the smartwatches is super accurate as far as VO2 reading goes. But I think it is a good way for you at least to track and trend how you're doing. So the more you exercise, those numbers should continue to improve. So I like the idea of it. And Carolyn, what I love to hear and the data supports is that the benefits of exercise start with that very first step. There's no magic limit that you have to get to before your arteries start being happier. The effects start immediately. And it made me think back. We did an episode a while ago about alcohol, and the World Health Organization says that the potential downsides of alcohol start with your very first sip. And now here we're talking about the benefits of exercise start with your very first step.
We sort of think that if some is good, more must be better. That can actually hold a lot of people back, I think, if they think, I got to do more and more.
Yeah, that's a big excuse that I hear.
It's a big excuse. And when you think about exercise, there was a trial that came out of Copenhagen, Denmark, and they looked at people who were joggers and they found what we call a U-shaped curve. So I want you to get this idea of like the Goldilocks spot, right?
Yeah.
So what we know is that people who don't exercise, sedentary people, they had a higher risk of death. And that risk of death declines, sort of like making a U, and it gets to a low point. And that was really at the moderate level of exercise. And then as exercise continued to increase and became strenuous, it started to go up again. And so what they found is that moderate joggers had the lowest risk of death, even compared to the really strenuous joggers.
Yeah, sedentary was the worst, but extreme exercise had its own potential side effects.
Had its own downsides.
Light to moderate intensity exercise seemed to be the sweet zone, with moderate kind of being the best spot. So I do like the fact that you think about this Goldilocks zone. And the way I think about it too, if we're going to talk about exercise as medication, you think the same way about any pill that you would take. Low dose or below the recommended dose doesn't really do anything. Too much of a dose is potentially dangerous. There's always going to be that sweet spot. And for exercise, it's going to be moderate intensity exercise.
This brings us now to let's talk about strength training.
Yeah. So I think in the past, most people, including myself, thought about exercise as walking, biking, swimming, aerobic stuff. And so this whole new resistance strength training data that keeps coming out is very encouraging, and I love it. It's changed my life.
It is. And it's changed mine too. And the data comes back, starting in like 2018, there was a study, they looked at 10,000 plus people, found that those who were doing strength training, they had a 23% lower risk of dying from a heart attack. And it didn't matter if they were doing aerobic activity or not.
Wow. Okay. So similar benefits as aerobic. Okay.
Similar benefits as aerobic. And so really, when you think about what's going on with strength training, when you're building lean muscle mass, it improves a whole bunch of cardio risk factors. So you increase your lean muscle mass. That improves your glucose metabolism and makes your insulin sensitivity better, because the muscles, there's more muscles. They want to take up all that glucose.
Right.
That's where they get their power from. And it also leads to building angiogenesis, right? We talked about capillary density earlier, because there's just more muscle mass that you have to get blood flow to. That's going to overall lower the resistance, lower our blood pressure, leads to improved arterial compliance. And all these things come together to help improve our cardiovascular health.
Incredible. Yeah. I'm going to break off and do 10 push-ups real quick here, because you motivated me to get moving. Okay. It's just all about strength. Yeah, Carolyn. So I think that's where we are today, is we're going to combine aerobic exercise with resistance training to get those synergistic effects that we're talking about, because they're so beneficial from a cardiovascular standpoint.
I call them magic. When you combine them, that's the magic.
It is. Oh, I like that. No, this is magic. So that's what it looks like, right? Because you get benefits from each are so good by themselves, but when you combine them, you get this synergistic magic that takes you to the next level. So I think that kind of brings us down to, let's get very practical about, what the recommendations are, how much you should be moving, because there are guidelines that direct us. The American Heart Association make the following recommendation. They say you should be exercising at least 150 minutes a week doing moderate intensity exercise. Or if you want to push to 75 minutes per week of more intense kind of training, that also is very beneficial.
That's where your doctor comes up with 30 minutes, 5 times a week. That's 150 minutes.
It's magic how that works, right?
Yeah, that's just math.
It really makes sense. Yeah. So, Carolyn, let's try to give our patients and listeners a very specific breakdown of what moderate intensity is, since it's such a generic term.
When I'm talking to someone in the office about how to start, the place I start really is how old is the person sitting right in front of me? This is where I get my averages from. So let's talk about a 40-year-old. So a 40-year-old, you're really trying to be building on established amount of fitness that you have. So you're really going to be looking to walk 3.5 to 4 miles an hour. You want to do it with some incline, maybe a little flat, maybe a combination of both. Cycling 12 to 14 miles an hour. If you're doing some hiking or resistance or circuit activity, that's kind of where I usually start the conversation with my average 40-year-old.
Yeah, I like that. And I think in general, when we talk about moderate intensity, we're talking about you should feel it, right? You want to get breathless with exercise. If you're with your dog and you're stopping at every mailbox, probably not good enough. You want to just kind of get that pace going, get the work going.
Right.
You don't need to knock yourself out, but you need to feel it, and then you need to keep progressing on what you're doing.
So let's move on to our 60-year-old. So if you're 60 and you're trying to start a new exercise program, you need to think about it in terms of adapting and staying active. So these are going to be some brisk walking, 3 to 3.5 miles an hour. Maybe you're using the stationary bike. Maybe you're doing some water aerobics to help get you moving. And then as we move into the 80-year-old, our focus changes. Focus changes as we get older.
Yeah.
And this is about maintaining function and being safe. We have to be safe as we get older.
This is where I started thinking about actually increasing the resistance training a little bit, just for your muscles, for your joints, for your stability, for your mobility. You do want to make some of it aerobic, but we may start transitioning a little bit also to just focus a little bit more on that resistance training for safety.
For safety purposes, for sure. And the American Heart Association, in addition to their 150 minutes of moderately vigorous aerobic activity, there's also a recommendation for strength training. So it's 2 to 3 times a week, 20 to 30 minutes.
Okay, well, I think we should move into helping people kind of understanding what some of the big exercise myths are, and then maybe overcoming those barriers that are keeping people from exercising, because we need to get you moving. Yeah, there's an endless array of these excuses, but I guess the next big one would be, I don't have time. I don't have time to exercise. Basic math tells me that there are 168 hours in every week. Recommendations are for about 150 minutes of exercise per week, which is 2.5 hours. So between that and maybe adding some extra time in for resistance training, we're talking about 3+ hours a week. So that's about 2% of your weekly time spent towards yourself, taking care of yourself, moving your body, getting stronger. And I think that's something that if most people really work at it, and if you told people your life depends on you finding 2.5 hours a week, somehow they may find those 2.5 hours. Well, your life, in fact, does depend on it. Maybe not tomorrow, but down the road. So 2.5 hours a week, find the time.
When we talk about time, we have to recognize that we don't have to do it all at once. There's not one right amount of time, right? So if you find that 30 minutes is too hard at one part of your day, you might be able to do 3 10-minute walks. And it's really important to know that the benefits add up with the amount of total time that you clock in.
And while we're talking about time and exercise, I think one of the big myths that we've kind of overcome was that being a weekend warrior, we'll call it, was dangerous. Well, fortunately, there are some new clinical trials that show that being a weekend warrior, exercising only within those 2 days, is still way more beneficial than not doing anything. So the benefits are still there, no matter when you get your 150 minutes in, even if it's compacted into a couple of days.
That's amazing.
Yeah, I think that's key. And I've really been pushing that on the patients, because between the commutes around here and time and the kids, I mean, time, it's an issue. So we got to figure out ways around that. And so squeezing that time into shorter period makes a lot of sense, and it works.
And then the other thing, another place where I made mistakes with my own fitness journey was all or nothing. The amount of time, if I couldn't do a 30-minute workout, if I couldn't run as fast as I could when I was in high school.
Yeah. Oh, That's
It
a little
wasn't worth
scary to
doing it.
envision.
Yeah, right. Isn't that scary?
Okay.
But if I couldn't do that, this all or nothing mentality that stands in our way.
Yeah, I've fallen into that trap myself, which has
Mhm.
slowed me down at times. If I miss a day or two before this Weekend Warrior stuff came out, I thought, okay, this week's shot. Let me just look toward next week.
Right.
But I think finding any amount of time and just making it happen is critical, right? So I have changed my ways. Just make it happen, even though it's not perfect today.
I think one of our scary myths that we hear is people who come in and they say, well, I have heart disease.
Yeah.
Exercise is risky.
Right.
Yeah.
Yeah, I think that should never, ever be an excuse. There's no cardiologist that's going to look you in the eye and say, just go home and curl up in a ball. Don't
Right.
exercise because you got a heart problem. If you're having heart symptoms or there are heart issues, yes, we need to identify that, tackle it, treat it, and get you moving again. But we're always hopefully going to be in the spot where you're going to find some sort of exercise that your heart can handle safely. And that should be your goal. And if you're not there, you should get there with your doctor. And if you've just recovered from bypass surgery or valve surgery, hopefully you've gone through that cardiac rehab program that's going to get you in the mindset that it's safe to exercise on your own.
Right.
So there are a lot of ways to get there. Even if you've had heart issues, heart surgery, heart procedures, we want to get you to a zone where it's safe and you're confident to exercise and push yourself. We should be able to find that.
That's a great way to put it. And if you aren't being active at all, if you're being very sedentary and you start to move, pay attention.
Yeah, there are some people certainly like, I'm moving now. There's something not right here.
Right.
So you need to be aware of your body, especially if you aren't seeing doctors and you feel something that's not right. So we, of course, always want you to be safe. And so there are things we can do to make sure you get there. So make sure, though, that you talk to your doctor about symptoms you didn't expect when you do start moving.
Right. And you want to set some SMART goals. You're not going to go from sitting on the couch to running a marathon. You're probably not even going to go from sitting on the couch to going for a 30-minute walk every day. That's okay. That's where you're headed to, but you have to start somewhere. So be realistic about what you are able to do.
Yeah, exactly.
Yep. And be specific too. Instead of saying, I'm going to walk, I'm going to do something that's not realistic.
I think that's key, right? Instead of I'm going to start exercising, to say, okay, that's different than saying I'm going to walk 20 minutes after dinner each day, 5 days a week for the next 6 months. And we've talked about this many times. Until exercise becomes a habit, it's going to be a struggle. Once it's a habit, and that's going to take 3 months to become part of your life, and you've changed your life to the point where you're moving more regularly, that's what it's going to take. So commit to at least 3 months. Then it's part of your routine. Then you start missing it when it's not there. Mm-hmm. Then you know it's part of your life routine, which is great. That's the goal.
That's totally true. And remember, it's not about perfection. It's really just about progress.
All right. As we wrap things up here, we're doing this because exercise makes a difference in your life. You're going to live better. You're going to breathe better. Your mood's going to be improved. You're going to have less dementia. You're going to sleep better. That's what we're talking about, better quality of life. It all comes back to that. And exercise should be a central part of how you're going to improve and maintain that quality of life into your 80s and beyond.
I hope we gave you some really good ideas or a place to even start. You never know when just one statement just going to click it all in and just be the right thing to change somebody's life. It was like that for me. I am not an exerciser. Don't describe myself as that. And somebody about 5 years ago, let's not give him too much credit, said to me, "Doctor, you need to exercise." And my first response was, fine, right? It was fine. And when I really thought about it, in my own head, I said, "Lacey, how do you think this is going to go? Really?"
Yeah.
I was exhausted. I was hurting both physically and emotionally. And I really started to think about, what are the next few decades going to be like that if I feel like this already? And that was it. That was it for me.
That's amazing. I know you've been consistent. You've been consistent for 5+ years. It's amazing. And you're busy cardiologist, a mom, and doing all this extra work and doing a podcast and getting the exercise in. It's very impressive.
And making it work.
The most interesting part of everything you just said was that you refer to yourself as Lacey in your mind as you're thinking. Okay,
Lacey.
That's interesting.
It is. Yeah, that's how I call it. That's what I call myself.
Perfect. Thank you, Lacey. And, here, I got to throw out the line I've been using for years on my own patients as hopefully a trigger. I tell people to only exercise on the days of the week that they eat. So you have to make a decision there, how you're going to go about it, right?
How's that working out for you to say that?
I usually get a chuckle out of it
You
once
get a
people
chuckle?
understand, like, what I eat every day. Oh, okay. Oh, that's nice. Okay. So anyway, hopefully that's why we're here. Get you
Right.
moving for your heart and for your brain. Thank you so much for listening, and we look forward to talking to you again real soon.
And if you have other episodes, ideas for us, let us know.
Yeah.
We love to hear your feedback.
We're starting to get some good feedback, and we
are.
appreciate that.
Thanks so much for listening to Living Heart Smart.
Thanks. See ya.